Thank you, Dr. Pai. Really fascinating information. I have some personal friends who have pacemakers, including Pete. Our next speaker, Danielle Thornton. Danielle is the Community Health Education Coordinator for NAMI Minnesota, which is the National Alliance on Mental Illness, where she advocates for more comprehensive mental health practices through health education and creating spaces of support. Danielle leads NAMI's smoking cessation efforts by working with community members and mental health professionals to provide education on the connections of tobacco use and mental health. She holds a BS in Public Health and Community Health Education and is a current Master's in Public Health student in the Global Public Health at Catherin University. Danielle continues to use her education and diverse public health experiences within disaster relief efforts. The mental health campaign, Make It Okay, and the crisis text line to uplight the mission of NAMI. Let's all welcome Danielle Thornton.
All right, hello everyone. Thank you for having me here today. My name is Danielle, and as it was mentioned, I work for NAMI Minnesota. NAMI is the National Alliance on Mental Illness. We're a national nonprofit that specializes in education support and legislative advocacy around mental health. So today I'm here to talk a little bit about the connections and the importance of addressing our mental health and the interconnections it has with our physical health. So NAMI Minnesota is a peer-based organization as 100% of our staff and volunteers either live with a mental illness or have a family member who does, which means we have been there and understand mental health conditions. We work as advocates and educators, which mean that we get to engage and facilitate in dialogues around mental health, and in my role specifically, health in general. We do this work throughout communities across Minnesota, in institutions such as schools, workplaces, community centers, libraries, medical centers, and so many other places. We regularly lead virtual and in-person support groups. As we heard from earlier, the benefits of support groups. You can find a NAMI Minnesota support group almost any day of the week. We also lead classes for the general public on topics such as suicide prevention, mental health, and health in general. We also have a helpline that provides support to individuals by connecting them to vital resources that can help them navigate challenging situations. And lastly, we work endlessly to promote legislation and laws around gaining more access and support in funding and resources, additional training for mental health providers across the state of Minnesota. So these photos up here are just a handful of some of the events that we get to participate in. You can see our executive director up in the left-hand side, Sue Abderholden. This is her at our NAMI Walk, which is one of our biggest events that we have during the year. And it's a time that we just come together to celebrate all the work that we do and to celebrate advancements and knowledge around mental health care. We also have my team that I work on. And you can see this was our holiday party, so I have reindeer antlers on, not my typical office wear. But we, again, come together to support those living with a mental illness. And then lastly, two of my colleagues down there, this is them in a school doing one of our school classes, and it's called Shoe Days. And so this is a program that they go into the schools and kind of engage in conversations with students about what it might be like to walk in another person's shoes for a day. So today, we are here to gather to bring awareness and to discuss aortic health. When we talk about events such as a provider performing a procedure, a patient recovering, or simply trying to make changes to our own health, it is important to consider the state of our mental health and the impacts that it can make. Because whether we like it or not, those impacts are going to come with us. And while there are many things in life that we cannot control, we have the opportunity to choose ways to grow from an experience, build resilience, and emerge with new tools. Although our health experiences are deeply personal, there are people out there who can help us navigate that information and help us make more informed decisions. In one of my youth-centered classes that I teach, it's called Ending the Silence, and this is a class where I go in and discuss with students the importance of talking about our mental health, as well as educating them on resources that they have available. I share the message with them that mental illnesses impact how people think, feel, and act. And when I teach this class, I typically ask them, when is a time in your life when you aren't thinking, feeling, or acting in some capacity? And so sometimes the students just stare blankly back at me, and I don't really get a response. But the point that I try to make with them is that we're always thinking, feeling in some capacity. And so just demonstrates the importance that mental illnesses and mental health in general is a topic of health that we must learn more about and have discussions about when it comes to any other aspect of our health. So many people know that mental health and mental health conditions are on the rise throughout the United States. And according to the CDC, we have seen a 30% increase in symptoms of anxiety or depression since 2019. These two conditions are the most commonly diagnosed mental health condition in the United States. We are seeing trends of higher rates of young people struggling with their mental health and suicidal ideation. 71.6% of people with chronic diseases experience mild to extremely severe levels of depressive symptoms compared to 31.7% of those without chronic illnesses in 2020. And some individuals who struggle with their mental health may turn to alcohol or drugs to help cope with challenging and complex symptoms. And throughout the pandemic, we saw this on a rise. Those already living with a mental illness were impacted by decreased access to care, treatment, longer wait times, and a reduction in mental health workers. Reports have shown that the decrease in exercise, routine appointments, going to labs, or getting regular checkups also made it more difficult for those living with a mental illness to manage those conditions. And these are just some of the statistics showing that mental health has an increasing impact on our communities, which is not always related to genetics or a clinical diagnosis. Public health experts continue to stress how mental health can be influenced by societal, environmental, coping strategies, or comorbidities. In fact, according to the American Heart Association, psychiatric disorders represent the most common comorbidity among individuals with a congenital heart disease. And we know now that individuals with a serious mental illness are 2 to 3 times more likely to die from a heart disease than people without a mental illness. Mental health disorders such as depression, anxiety, and PTSD can lead to higher psychological effects on the body, such as a reduced blood flow to the heart or cardiac reactivity, which all have impacts on heart health. Attending to our own health or our patient's health, and mental health in particular, may play a role in the impacts of a heart condition, as well as have a positive influence on long-term health outcomes. The American Heart Association mentions that nearly 25% of cardiac patients post-surgery experience cardiac depression, meaning that patients following heart surgery may experience depressive symptoms such as feeling lonely or lacking energy or the ability to engage in activities that they normally do. And this invites both patients and providers the opportunity to be honest about post-surgery expectations and to set up a plan of support. Depression can worsen a heart condition by nearly 80%. Negative psychological factors such as anxiety, depression, and catastrophizing have been found to predict post-operative pain. And so there's still not a lot of current information around the impact of pre-operative psychological care and its association between post-operative cardiac outcomes, But some research is starting to reveal that there is potential for positive association, which is hopeful. So this is a model that was published in the Current Cardiology Reports, and it points out the connections of potential effects of preoperative psychological implications and how they can have an influence on outcomes after a heart surgery. So you can see the solid lines. These things include psychosocial risk factors such as low socioeconomic status, anxiety, depression, and they have a direct link to outcomes after surgery, such as pain, wound healing, complications, things like that. And then you can also see the solid line of cardiac surgery and how that also, of course, directly impacts the outcomes of that surgery. And so what this model is suggesting, that if individuals have psychological preparation before surgery, so these things include additional information or more in-depth information about the surgery, what they might be experiencing, things like that, other things such as psychological support before the surgery, or modifying and optimizing expectations of the surgery and how it can have an increased impacts on post-operative outcomes after the surgery. And so you can see the dotted lines there, how those psychological preparation can directly influence post-operative outcomes or directly influence as well. So evidence published from a study in the National Library of Medicine suggests that psychological preparation may be beneficial for reducing post-operative pain, also reducing negative effects on the body, as well as decreasing the length of stay in the hospital, and then lastly, increasing behavioral recovery. And it is unlikely to be harmful for patients undergoing heart surgery. So this example is how intentional education, patience, and compassion can positively improve health outcomes for individuals. So knowing that psychiatric problems can lead to adverse health effects on patients' quality of life, this allows an opportunity for providers and patients to come together to have a better understanding and manage expectations. In one suicide prevention class that I teach, called QPR, we talk about the clues of suicide. And so these things can include verbal clues, such as an individual saying, I don't want to be here anymore. It could also include actions, so a person giving away something that they find valuable, or a situation that a person might find themselves in. And this can include being fired from a job or receiving a life-threatening diagnosis. And so these are just some of the clues that someone in a psychological distress might reveal or experience leading up to a crisis. I talk further in this class that it is first necessary to notice these warning signs before we can then take a step in to take an action. I think this concept applies in the same sense in how our bodies give us biofeedback or clues, possibly telling us that something is off. Any symptom our bodies experience, whether physical or psychological, invites us to turn our attention inward and ask ourselves, what might my body be telling me, or what might it be showing me? And we can do this with both our physical and mental health symptoms. And when we begin to treat them as interrelated, we begin to look at health as a holistic approach. Now, addressing mental health conditions can be done through clinical psychological care, such as medication or psychotherapy, but not all people need the same level of care. And some people do better at supplementing other daily activities or combining various options. And so these things, there are things that we can do to protect our brain as well as promote a healthy mindset. And they can include things such as daily movement, fueling our body with nutritious foods, practicing gratitude. It is widely known that exercise can improve mood, cognitive function, sleep, and so much more, which can lead to better health outcomes overall. But many people still struggle to see the positive association or to see exercise or any of these other daily habits we can implement as a tool that can actually impact our mental health. Research also shows that practices such as mindfulness and gratitude awareness and practice can really help an individual to shape their perspective on a situation. People who regularly practice and express gratitude for the positive things in their life are shown to be happier overall, leading to reductions in stress and depressive episodes. So this photo here, this is a photo of Lake Manitosoa in Madagascar. And just a little personal story of my own. After I graduated from undergrad with my degree in public health, I decided to join the Peace Corps. And so I was placed at a clinic in Madagascar. And so this lake was one of the lakes that we got to look out on during our training session. And so I was only in Madagascar for probably about a month before the pandemic happened. And so I was devastated that I had to be sent home, and this was, a goal and a dream of mine that I had worked on for quite a long time. And so as I got home, I started to try to navigate next steps in my life, and it was a really confusing time. And so this time was a time in my life where I really struggled with my mental health. And I think a lot of people can relate to the fact that they had things taken away or plans changed because of the pandemic. And we can see from the previous statistics how that impacts people's mental health. And so one thing that I decided to do for myself to kind of help me release myself from being attached to all those negative thoughts was to start a gratitude journal practice. And so this is just my own personal experience, but through daily gratitude journaling, through meditation, prayer, and therapy, I finally was able to come to a place in my life where I felt more peace and acceptance of the situation, letting it go, understanding, maybe this isn't the best fit for me right now, and really appreciating where I am right now. When I first started this gratitude practice, I kind of put up a little bit of a fit, and I didn't really want to do it that much, but I felt like I had no other options, especially just from my own personal experience struggling with my mental health. It can be really difficult to get out of bed, to have conversations with people, and really just do a lot of things that we would do on a daily basis. So the things that I started to write about were things that I didn't have in Madagascar. So I would write things like a flushing toilet, or new options for a comfortable bed, or not having to walk 3 miles to get anywhere. And so having that experience, although I was devastated to be sent home, and I'm sure a lot of people were also devastated by things that they lost during the pandemic, I've really come to understand that I was there for a reason. I'm really grateful for that opportunity, and it's okay for me to move forward. And so I really hope that through our actions and our daily practices, we can kind of learn to overcome stressful events in our life, such as a heart diagnosis, such as a stressful job, anything like that. And so this story, I think, really transitions nicely into the concept of self-care. So gratitude journaling was something that I did for self-care. And self-care is, I think a lot of people see it as a luxury, which this should not be the case. Self-care really is the foundation of our healthcare system. And so I found this quote from Dr. Portia Jackson. She's a doctor of public health that summarizes what she thinks self-care should be. So she states, self-care should also involve nurturing work that goes beyond the surface layer. A lasting self-care and wellness plan that can effectively manage stress should honor personal experiences and individual backgrounds. And so self-care is going to look a little different for each and every single person. And so it's our responsibility within our own health to figure out what's going to work for us. Some positive self-care things that we can do to avoid a crisis can be being kind to ourselves, being aware of our reactions, accepting where we are in our own journey, daily movement, consuming nutritious foods, as well as endless other things that I possibly just don't have the time to go into. And so we know any of these actions can be very useful and powerful because they can allow us to take back control over our thoughts, feelings, and emotions. When we do this, we see just how valuable and informative they are not only to ourselves, but also to the people around us. And now taking care of our mental health is just not for patients. As a study published in the Journal of American College of Cardiology states, more than 1 in 4 cardiologists experience self-reported mental health conditions globally, and the association with the adverse experiences in their professional life are impacted substantially. We also know that there are substantial rates of compassion fatigue amongst many medical providers. So once again, this just shows how mental health conditions can impact anyone. Even though there have been more conversations and more normalizing surrounding mental health, many people still feel unsafe or uncomfortable to open up in certain spaces, such as at work, at school, with their loved ones, or with a medical provider. This is why it's so important for individuals in all spaces to have support and access to resources that make them feel empowered to speak up about their mental health. It not only allows others to see that it is okay to do so, but it also shows others how to best support them. And so just as the systems within our bodies are all connected, so too are our social systems in which we live. When we start to heal one aspect, we begin to heal others. And so this is where the concept of hope comes in. And we've already heard a little bit tonight about the concept of hope. And so I think that's the really amazing and powerful thing about hope, is that it can show up in a variety of different ways and in different settings. And so it is not uncommon when dealing with a mental illness or a physical health condition to experience feelings of incredible loneliness or hopelessness that often, a lot of individuals in those situations often feel that others don't fully understand what they're going through, and so then they think that nobody really cares. In fact, the feeling of hopelessness is a major emotion for those in a psychological crisis. Individuals outside of the crisis, though, don't have to completely understand what that person is going through to be able to show support. And almost any positive action can be met with relief. Providing hope can be simple as listening to another person. Someone once shared with me that you can listen someone back to life. I've talked with others about where they have also found hope. One person shared with me that in their season of life, hope looked like reconnecting with friends and just being around other people. Another person shared with me that they found hope in their granddaughter, and that sharing in her successes was something that they looked forward to participating in. Another person shared with me that hope looked like, after making some major life shifts, that she was able to enter and to remain in remission after being diagnosed with cancer. This person also shared that she thought that her mindset and her mental health in general played a significant role in her recovery and becoming cancer-free. When we take care of our mental health, our physical health follows, and vice versa, leading to approaching our health as a whole. When we do this and align our hearts and minds, recovering, healing, and hope are possible. And I want to close with this quote from the director of the World Health Organization, and he just highlights the importance of investing in mental health. And his quote reads, everyone's life touches someone with a mental health condition. Good mental health translates to good physical health. The inextricable links between mental health and public health, human rights, and socioeconomic development mean that transforming policy and practice in mental health can deliver real, substantive benefits of individuals, communities, and countries everywhere. Investment in mental health is an investment in a better life and a future for all. Thank you.